blood flow, and resistance slow down the blood flow. Pressure will drive the blood. Resistance, like I told you, like resisting. Okay, if in a large classroom, someone's at the door, everybody trying to go out, and one person standing there going the opposite way, that's resisting it, so it will slow the blood flow. Flow would be volume of blood per unit of time. Pressure is the force, okay, per unit that's exerted on the wall. Causes flow from high to low pressure. Resistance, slow the flow down to help exchange. This could be friction. So remember we talked about the arterial pressure. When the heart first squeezes, there's a lot of pressure in the beginning, and the pressure will slow down. Okay, so this is called mean arterial pressure. Mean arterial pressure. Okay, all it is the average blood pressure in the artery. The average blood pressure. So here's a formula you don't have to remember, but if you want to remember, so is the diastolic blood pressure plus 1/3 of the systolic minus the diastolic. Okay? Ventricular contraction, pressure rises. Systolic starts to flow from high pressure. Okay? As the ventricle relaxes, the pressure will drop. Okay? As it drops, the pressure will drop, and the semilunar valve closes, so blood doesn't return. Couple of terms to remember. Ischemia is when there's not enough blood flow, and hypoxia when there's not enough oxygen to the tissue. Pulse. So here are several places we can measure a pulse. Okay, and the foot and the knee. Okay, anywhere where there's an arterial tree. A pulse is simply an expansion and recoil of the artery. So as the heart squeezes blood across the body, the blood will expand. As it relaxes, it's going to collapse. Not completely, but So a pulse is just an expansion and recoil of the artery. How to measure it is usually just 25% of how hard the systole really is. So pulse pressure is usually systolic minus diastolic, usually 25% of the systolic pressure. Okay. Measure this force. There is something called a Korokov sound. Korokov sound. Okay, Korokov sound is when you learn to do blood pressure the traditional way. You wrap the blood pressure cuff around you and you squeeze it really high until you don't hear the blood pressure anymore, until you don't hear the pulse. And then you slowly let go of that little valve. Slowly let go until you hear the first sound. Now you have to remember that number. That's your blood pressure. That's your systolic number. Okay? Until you hear the first sound, and you keep hearing ba 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 until the last sound. That would be the diastolic pressure. So the first sound you hear, okay, cool, because you raise it up so high, usually about 30 above where you stop, and then you hear, because the blood pressure, the blood artery is collapsed, you don't hear it anymore, and then you start letting go. You're letting go of the valve slowly, and you hear boop boop. That's your first number you record. In this case, it would be 120. Okay, and then it keeps going down, and then you don't hear it anymore. This would be 80. So 120 over 80. That would be the normal flow blood pressure. Several terms we need to familiar with. We already saw this term. Cardiac output is the stroke volume and the heart rate. Compliance is how much things can stretch, how much the blood vessel can stretch. Blood volume, we saw. Blood viscosity is how thick the blood is and how long the blood vessel is. So cardiac output, remember these? Any factor, for example, your epinephrine, your thyroid hormone can affect your heart rate. Calcium can affect your heart rate. That causes cardiac output to increase and will increase arterial pressure. So as the more your cardiac output squeezes, the more you have your blood pressure. So this, of course, is the opposite, parasympathetic. This will decrease cardiac output and will decrease the blood pressure. Compliance. Again, we saw how much a blood vessel can expand to accommodate the blood. Okay. Ability to expand when there is volume increase. Okay. For example, a metal pipe cannot, but a balloon can. Okay. Recall that veins are very compliant. If there's a decreased compliance, okay, so it doesn't stretch, the resistance increase. Okay, resistance is more friction. Okay, and then because of that, there's a higher pressure in the vessel, and then it decreases the flow. Because remember, blood is not just liquid. Okay, there's stuff inside. Blood volume, how much blood you have, usually 5 to 6 liters, depending on age, size, sex. Okay. Pressure is directly related to volume. Think about a water faucet. If the blood volume decrease, so you have less blood, your pressure and the flow will decrease. Okay, this is called hypovolemia. Hypovolemia. Okay. It could be caused by hemorrhage, bleeding somewhere, dehydration, vomiting, severe burn, you don't have enough liquid. Okay. If blood pressure increases, then the pressure and the flow will increase. You remember we talked about one of the hormones when there's blood pressure decrease is aldosterone. Okay, that will increase. And ultimately it will cause the kidney to absorb more liquid. Okay, but we'll see that later. If blood volume increases, then the pressure and flow increase. This is called hypervolemia. Okay, sodium or water retention, kidney or heart failure. Blood viscosity is how thick it is. Okay, this is a direct influence on resistance. The thicker it is, the less easily it would flow. Increased viscosity, increased resistance, which will then decrease the flow. Just think about honey, or I guess in this case syrup. Okay, the thicker it is, increased resistance, and it will decrease the flow. Viscosity depending on plasma protein and the form element inside, especially red blood cells. Length is directly proportional to resistance and inversely related to flow. Okay, let's study that a little bit. If increase in length, so the longer it is, increase resistance and decrease the flow. So the farther it is, more friction, everything will slow down. Blood vessel length is fairly constant, but increased weight will increase vessel length, more stress on the heart. Diameter changes throughout the body. You remember, artery, arterioles, and capillaries. The diameter gets smaller. Diameter is inversely proportional to resistance. If the diameter increase, okay, it gets bigger, resistance will decrease. Okay, of course, it gets bigger, everything flows easier, and the increase will flow. Okay, arterioles are resistance vessel. Remember in the beginning we talked about it slows it down so that it will give a chance for the capillary to do their exchange. Okay. You don't have to know this formula, but if you want, here it is. So we talked about the veins returning, okay, and these valves. So every time actually you walk, you squeeze your legs and whatever, okay, actually pumps the venous blood back to the heart, okay. Okay, it pumps it back, muscle contraction. But when you relax, right, these valves will catch these blood, okay. So someone standing too long, okay, prolonged standing, a lot of blood will stay here, stagnant, and it will cause the valve to get bigger because there's a lot of blood. Later on, it will cause something like a varicose vein. Those little bumps are actually, these valves stretched. Venal constriction on resistance blood flow. If arterial or artery constrict, okay, let's read this carefully so you can understand. If the arterial or artery constricts, so they get they squeeze, resistance and pressure will increase, but the flow will decrease. If a vein or venule constrict, the lumen, which is not oval, and this decreases resistance, however, pressure will increase, so will the flow. So remember, veins are got the big lumen, okay? When you squeeze it, everything will go through much easier, okay? And therefore the resistance will decrease, it will go right through, okay? And pressure will increase as there's more squeeze. Okay, so opposite the artery. Okay, so remember 3 types of leaking. Okay, capillary exchange, gases, lipid soluble, diffuse